Can you hear
Yes,
me?
doctor. Yes, yes.
Very good, Said. Yes. Oh, Salama. Salama was actually asking me about the quiz a while ago. I would like to repeat, no? Uh, the quiz is rescheduled on May 6th. That will be after your CA. The quiz is only for those whom I approve. All right. If you receive an email and I said so, then you are going to take the quiz immediately after the CA. The coverage will only be on personality. Okay. So
Okay.
let's start now with our discussion. Salama, is all right now?
What?
You understood now?
Yeah, yeah.
Okay. So immediately after that means to say 11 o'clock, okay? Because your exams will be around 10 and it is paper based.
Okay. After 2 days?
No, after the exams, 11
Okay.
o'clock. Okay.
Okay. Okay.
All
Thank you,
right.
doctor.
So let's proceed now. I have another topic here, abnormal psychology. After taking very important topics in psychology, that is pertaining to the theories of personality and also with counseling and psychotherapy. Now, let us try to look into what constitutes a pathological condition in psychology. We have to understand also that in psychology, we have to study those who are deviating from the norms. We have to study the normalcy, the normal attributes of mental health and psychological makeup of an individual. Then at the same time, we have to look into the abnormality, what constitutes the so-called pathological condition, so that appropriate treatment, not necessarily drug, will actually be given. All right, so let's try to look into the perspective in understanding abnormal psychology because people sometimes deviate. Now, this is usually the problem that we have. We tend to judge other people, but under what standard that we are actually going to look into? Sometimes we are telling you are crazy, and of course, other people will tell it as a joke, but some people will take it as if they're very serious. Now, when we are doing that, we are supposed to set a standard where we will actually judge, where we'll attribute some abnormality, some problem. Just like when we are going to make our diagnosis in dental health, when we say sometimes, when we say somebody is sick, uh, there is a problem with the tooth, with the oral cavity, we will actually say some sort of norms. What could be the basis? So we should know what's the normal. Then after that, we can actually make diagnosis. So this is exactly the main point that we are going to discuss today. So what are we studying? We're going to look into abnormal behavior, behavior that deviates from what is supposed to be norm, what is supposed to be normal. Who said this? This is set by the society. This is set by, of course, the things that we study in psychology. No? As you will know, behavior is a manifestation of what we think. When somehow we deviate already, when we show some sort of deviation in all our action, like eating glass, eating nails, then there must be a problem. We call that, by the way, a spica. Or some sort of, we are already pulling our hair out, then there could be some problem here. We call that as personality disorder. So basically, we are going to look into that. When there is some sort of deviation with our actions, with all the things that we show to people, then that will be under the norms of abnormal behavior or abnormal psychology, right? Always take note of this. Abnormal psychology is different from psychiatry because psychiatry studies the treatment. In abnormal psychology, we're going to look into abnormal behavior. We attempt in understanding abnormal behavior. Treatment is the last thing that we have to do. But of course, in treatment, we will consider psychotherapy as such. We are going to look into psychopathology also. If we have in diseases, I believe in medicine they're teaching already pathophysiology. In psychology, we're going to look into the causation of the disease. What caused an illness? Let's say someone, do you see the slide? Will you be able to see the slide and then move it to the slide? Because sometimes there are problems here. I do not get a response. Are you there?
Yes, doctor.
You see the slide?
You are in the first slide.
So what are we studying, right? Is it?
No,
Oh,
abnormal psychology. Yes,
oh,
right
okay.
now we can. Yes, we can see.
There is a problem. That's why I'm asking you. Yeah. So psychopathology, we are looking into the cause. What could be the cause? Because in medicine, in psychology, and some sort, you see, the moment that we know the cause, we will be able to treat. We'll be able to find some sort of a solution. Whenever we know the cause, then we are going to look into the cause and treat that cause. So psychopathology is understanding the cause of the abnormal behavior. That's why we call it psychopathology. And psychopathology is discussed very well in the new book that was released by American Psychiatric Association with the collaboration of the American Psychological Association, the so-called Diagnostic Statistical Manual 5. We have that 3 years ago. It was the release. So every year, a group of psychologists and psychiatrists are working together in order to revise what constitute abnormalities and what could be the basis of our diagnosis. That's psychopathology. And somehow we are going to look into array of mental disorders. What are the different mental disorders? There are classification, like for instance, when we are going to look into emotion, so that classification is under emotion is affective disorder, right? When there is some sort of problem with our personality, we call that as personality disorder. When there are some sort of deviation in terms of the way we think, we call that as cognitive disorders. See? So there is an array, there is a grouping that a specific cause can actually be attributed to this, and specific treatment may actually be delivered in order to help the victims or the patients in that way. And of course, we're going to look into mental illness. What is mental illness? When you say illness, that means to say there is something wrong already. So deliberately, as medical health workers like you, dentists, we are always looking into illness. What is the meaning of illness? There is a disease. There is a pathological condition that we need to root out, that we need to treat, right? So we are going to look into various conditions associated with mental illness. Then, of course, we will look into deviant behaviors. When you say deviant, these are behaviors that are way out of normality, that is different or that's not accepted, or different or deviated from the norms. That is what's acceptable in the society. Like, for instance, I give you some sort of deviation. When you see some people who are not taking a bath for months or even years, there are people like that and they're roaming on the street. There are people who are eating their own faces. There are people who are eating something else. And there are people who are supposed to be reacting differently. That is, the situation warrants that you're going to cry, but you are laughing instead. So these are some sort of deviancy that is way away from what is expected behavior. So we are going to look into that. When you say deviant, these are things that are not normal. Another example of deviancy are rapists, those people who do have some sort of sexual misconduct. There are other people who actually kill other people, and some sort of things like that. Now, these are deviancy. So let us try to look into the study of mental disorders. No, so what do we involve here? All right, what we mean when we say mental disorder? Of course, definitely say mental disorder, there is already some sort of abnormality associated with your behavior, associated with how we think. There is already a problem. See, disorder, there is a problem. This is out of order. Now, the word says disorder, abnormality, or out of order. So we have to fix that. If you are a dentist, you have to fix problems pertaining to teeth. If you are a medical doctor, you have to fix the problem pertaining to our health. If you are a psychologist or a psychiatrist, you have to fix the problem pertaining to our thinking and behavior. You see? Now, how do we distinguish between different mental disorders? As I mentioned to you, we have to classify them in accordance with the array, in accordance with different umbrella of classifications. Like when it pertains to personality, we call that as personality disorders, and there are so many sub-classifications pertaining to that. When you say cognitive disorder, there are classifications pertaining to that. The most common is schizophrenia. Then we have affective disorder. This is pertaining to our emotion. Then some well-known disease pertaining to affective disorder would be depression. That is clinical depression. You see? So the Diagnostic Statistical Manual classify them and describe them. Every specific disorder that's known to man currently, it's described there. These are the things that we accept as mental disorder. All right. Now, how do we understand mental disorder? So this is basically the point. We have to find out the normality, the normal points. What should be the normal behavior? So psychologists are studying how an individual, how a person acts, behaves in a certain way and in a certain condition. So this is what we need to know. Now, I understand that you are studying to become a dentist. So right now you are studying the normal anatomy and physiology of your oral cavity. Now, this is quite difficult also. It goes together with psychology, you know. Abnormal, this is oral biology, right? So you are going to look into specific parts. Then eventually, when you are going to be practicing as dentist already, the knowledge that you learn from your oral anatomy and oral biology would always be the basis of what could go wrong. You see, you are going to look into something, the thing that is deviating from your oral anatomy, so that you can actually say this could be the cause and this could be eliminated. In what way? By surgery or giving antibiotics or any other treatment as such. So that is how we do it. We have to have a basis in order to actually say that that condition is abnormal, that that patient is suffering from this specific disease. Now, in terms of treatment, how do we treat them? Now, basically, in psychology, we are not drug dependent. We are not using medication. We are not using treatment. Instead, we are using a specific tool, like in the case of psychotherapy and counseling. These are the specific tools associated with psychology. Now, in the United States, there are states that are actually licensing psychologists to prescribe medication, but that's a long way to go. Now, who uses medicine or drugs? Definitely psychiatrists, no? Because psychiatrists are authorized to give prescription. So this is the main difference between psychologists and psychiatrists. Psychiatrists are medical doctors that are trained in psychiatry, so they can prescribe. But psychologists cannot prescribe. Generally, psychologists cannot prescribe. We can only use our skills in doing psychotherapy and counseling. That's how we treat mental disorders in the perspective of psychology and abnormal psychology. Now, moving forward, these are the mental health professionals that we may consider. Now, we have clinical psychologists. Clinical psychologists are treating or dealing with people who are mentally ill. they are stationed normally in the hospital. What could be their degree? Clinical psychologists must have a PhD or doctor of a psychology degrees. You see, they are not medical doctors. They have PhD. They are trained to treat people who do have mental disorders with the use of psychotherapy and other skills. Now, another one, of course, is psychiatrist, medical doctor. MD stands for medical doctor or doctor of medicine. Psychiatrists are trained physicians. So they treat basically mental disorders who are confined in the hospital, or they see psychiatric patients also, and their main job is to treat mental disorder with medicine, with drug, because they can prescribe. They are trained as medical doctor in BDS or MD. In BDS, then you have to do your specialization also. Just like in dentistry, the first thing that you are going to be when you graduate from your 5-year course will be general dentistry. Then after that, you specialize in a specific specialty. Likewise, in medicine, in BBS or MD, after graduation, you will be a physician. You can treat anyone, but eventually you try to narrow down your practice into specific disorder. If you want to be a psychiatrist, you treat disorders pertaining to abnormality of the mind, abnormality of human behavior. So you treat them with medicine, all right? Then psychiatric social workers, these are trained social workers. They have a degree in social work, usually bachelor's degree and master's degree. Now, what do they do? Basically, social workers bridge the hospital or healthcare facility with the community. This is one of the very big problems that we have in mental health. The moment that a family member would have a mental disorder, there is already a stigma, as if the mental disorder brings stigma to the family. And sometimes when they bring the family members to the hospital, these family members tend to be forgotten. So that is usually the problem. Now, when the patient is going to be discharged from the hospital, they have nowhere to go. So what will the mental health social worker or psychiatric social worker do? They bridge, no? The family members and at the same time the patient. They coordinate with the community also, because you see, in a certain community, mental disorder is not well accepted, as not well understood. So this is basically where they are going to work, no? To bridge the institution, mental health institution with the community and at the same time with the family. And we have psychoanalysts. These are psychologists who are following a specific concept, a specific trend. So if you're going to be a psychoanalyst, definitely you're following Sigmund Freud. No? You are a follower of Sigmund Freud. So you are Freudian, because psychoanalysis originates from Sigmund Freud. This is a belief wherein you are going to, the abnormal behavior is caused by your experiences that are repressed, negative experiences that are repressed. So the treatment that we usually do would be hypnosis, putting someone to sleep so that you can actually get rid of your past. Okay? Then of course we have the therapists, the psychotherapists. Psychotherapists, not necessarily a follower of someone, as I discussed in counseling psychology. It could be eclectic, wherein the therapist would be utilizing various concepts to come out with the treatment plan so that they can actually treat the patient. So eclectic therapy or eclectic counseling, right? So that's the thing. But normally we term that as psychotherapy. Such. All right. So let us try to look into how are we going to define mental disorders. So basically, this is how we are going to set our lesson. No? Defining mental disorders, discussing particular abnormalities, as I mentioned to you, in specific umbrella, then the therapy regimens. So what is the meaning of mental disorder? Then we have to look into their classifications. Then after that, we have to look into their treatment. As a medical practitioner, you ought to know this at least, no? Okay, so what do we mean by mental disorder? So let's go with number one. Who has a mental disorder? No? Are they mass murderers? There are so many people in history who do have or who have committed mass murders. You know, these are the leaders in World War II, like in the case of Adolf Hitler. Definitely, Adolf Hitler do have mental disorder. We got that as personality disorder. Now, in abnormal psychology, we call that as megalomania, really, or the person who have delusional disorder in that case, among others, no? Or if you are just going to be a mother, there could be a personality disorder, the antisocial personality disorder as such, you see? So because why? Why we actually classify as such? You see, mass murder, this is the thing that is abnormal. Of course, not any individual can actually kill someone. We have no right to kill someone. So when you are going to do that, much more with other people, with so many people, then you should be abnormal because you deviate from what is set by the society. You are deviating from the rules set by the society. You could be branded as criminal, you could be branded as psychotic, you could be branded as something else because your behavior tends to be away or moving away from what is acceptable in the society. Or let's say, people who want to cut off their arms and legs. Is that a normal behavior? Definitely not. When you tend to hurt yourselves already, then there could be a problem. What could be the reason? The thing that we do as a human being is to live normally as much as possible in accordance with the rules set by the society. So we are expected to behave the way the society expects us to behave. The moment we think of hurting ourselves, then there is already a problem. It could be affective disorder. Okay? Because you see, when you're going to have some sort of depression, and this is very common among people with affective disorder, you tend to hurt yourself. So that is the violence directed toward oneself, committing suicide, hurting oneself, among others. Or it could be a personality disorder, like in the case of histrionic personality disorder, among others. Or borderline personality disorder, because if you do have borderline personality disorder, the tendency is that you're going to pull your hair. That's one of the most common descriptions that we have. And there are people like that. So that means to say, what I'm trying to emphasize is that your behavior is moving away from what is expected of the society. That's the main point. Or do you have a mental disorder when you can pay attention and concentrate? Definitely. This is not a deviation, but definitely this is some sort of lacking. So we need to give assistance in that particular case. Like in the case of people who do have dyslexia, difficulty in understanding, difficulty in listening, among others. So we have to pay attention. So they could be classified as such, but under mild disorders in that way, because we need intervention. We need treatment. We need the help of trained psychologists or counselors as such. So you could be abnormal in that sense. Now, mental disorder could be classified in 3 classic symptoms that we know of. No? These are the things that are not common, like in the case of hallucinations. When you say hallucinations, this is a false sensory experience. The thing that we can actually see exists, but the source of their existence cannot be established. Like, we can see someone, but in reality, that someone is not existing. We can hear a voice, but there is no origin of the voice. It's just in our head. So hallucinations always caters on our different senses. That's the reason why we call it false sensory experiences. Sometimes a person may actually register a problem pertaining to some worms moving around the skin. We call that as tactile hallucination. Okay? So when you smell something, but that source of smell is not there, there could be olfactory hallucinations. But the most common hallucinations that we have would always be pertaining to the thing that we hear and the thing that we see. Yet, the source of what we see and the source of what we can hear could not be established. There is also delusions. These are all very common among people with cognitive disorders. No, delusions. This is a disorders of logical thinking. Like you're going to think that you are somebody else. You are a Superman. You are on top of the world. You are the world leader. Like what the well-known megalomaniac was actually, thinking about. I taught you about Adolf Hitler. The thing he thinks that he's the most superior among all human race. So he killed millions of people. He eliminated the Jews as such. So that's delusion. No, it's a bloated understanding of what you could do. Then, of course, we have affective disturbance. Affective disturbance pertain to the disturbances that would be associated with your emotion. So, inappropriate, strong, or absent of emotional response. So, the classic case. So, the three, these are things that you have to look for when you are always diagnosing a patient with mental disorders. Okay? So, let us try to look into the real definition of what mental disorder would be. All right, so you can see this, no? What a mental disorder is, no? So this is actually, a mental disorder tends to balance, tends to have equilibrium. Our body, our mental health would always be trying to stabilize itself. Now, when it tells on the other one, it becomes a disorder, either or. So we tend to balance that one. But of course, in terms of classifying this mental disorder, we have to look into the degree of the experience that you may actually have. Either you're going to have mild, moderate, or severe. So this is the thing. No matter what, if you have mild disorder, then there is a problem. You need treatment. If you do have moderate disorder, then you need treatment. If you have severe disorder, you also need treatment. But the thing is, the main difference of treatment will be, do you require institutional care in this instance? For mild disorder, they can be treated in the outpatient clinic and they can stay at home. Moderate disorder, not unless they're violent, they can stay at home. But in the case of severe disorder, their functionality is affected. Definitely, they cannot stay at home. When you're already shouting in the street, removing your clothes in the street, trying to hurt someone, trying to kill someone, trying to kill yourself, then there is already a problem, very big problem. You need to be institutionalized. That is the meaning of treatment in severe disorder. That means to say the disorder prevents you to function very well. You cannot eat, you cannot go to work, you cannot do the normal things that you normally do. So you need hospitalization. So, but what about mild and moderate disorders? If you have this, you can still go to work. You can still do normally what you are doing, but your degree of performance may already be decreased. That is usually the problem. Like if you are depressed, if you are not suicidal, then you are still okay to live with your parents, to live in the community, to live at home. But if you are already suicidal, then you need to be hospitalized. You need to be supervised by a qualified clinical psychologist or a licensed psychiatrist. So that's the main difference and classification of the different levels of mental disorders. So here, a person who do have mental disorders may be distressed. These are some sort, no, of the descriptions that they may actually have. They are distressed, okay? They are maladapted. They cannot adapt with the situation, with the change that they may have. Right? Like for instance, if you have been recently divorced, so what happens is that you cannot accept the fact that you're already divorced from your you're already divorced from your husband or wife, you cannot take it. So you tend to be depressed. So that's the problem, no? So you may actually have mental disorder. You need to have a help of a psychologist or a psychiatrist. Then irrationality without reasons already. Your reasoning is already faulted. In extreme condition, of course, sometimes your reasoning may be acceptable, like what we have in the picture. You see, in the picture, this is what we have in the Tiananmen Square. You know, when communist students demonstrated against the communist regime. So there is someone who stood in front of the 4 tanks. You know, so of course, this is some sort of, in a normal sense, irrational, because who is the person to stand in front of the tanks? Definitely, you're going to be crushed. But that one is already acceptable because they're trying to fight for something else. They're trying to fight for principle. He is stopping the tanks in this case. I think you have seen this. It's projected so many times in the news. This is a famous Tiananmen Square demonstration. A lot of these people were killed during the revolution in China. Then unpredictability. Then unconventionality. What is the meaning of unconventionality? You're already deviating from what the community and society is expected of you. Like you are starting to eat your feces already. You are starting to drink your urine already. You are going to the street naked already. You are not taking a bath for quite some time already. This is the problem, no? Or maybe you are wearing you are already starting to wear dog ring, a nose ring, or a very big earrings, among others. That could be classified as deviation from the society. See? So you are very unconventional in a way. There are people like that. Artists, if you accept them, then it's okay. But if the society does not want to accept them, then there is a problem. All right. Then, of course, observer discomfort. When people who are observing them suffer discomfort already, like as I mentioned to you, when someone is eating something else, or when someone is doing some sort of stunts, it may contribute to the discomfort of the observer. Then you could be classified as prone to mental disorder, or you could already have a mental disorder as such. All right? So, moving forward, now reasons for differences in rates of disorders and types of symptoms are the real cultural differences. Now, we will look at mental disorders would always be having some sort of leaning in terms of our cultural affiliation. Like in the case of this country, Muslim country, our Muslim belief, our Islamic belief is still very strong, wherein some sort of mental disorders could actually be associated by evil spirits. So we need the imam in order to pray for a person. We have seen so many patients like that. No, before they would go to a psychiatrist, they would go to imam first and do some sort of prayers, so that they are going to cast away the demons inside the man. In some Christian countries also. But in the United States and other European countries, they're very open. No, you have some problem, you go to a psychologist, you go to a psychiatrist. That's why the practice of psychiatry and psychology in other countries are booming, are actually increasing. In the United Arab Emirates, I don't think so, no? Because there are only few psychologists so far right now, and there are only few psychiatrists in different hospitals in this country. So we are still tied in our cultural and at the same time religious belief. So of course there is a differences, there is variation in terms of how we look at this mental disorder. Now in terms of personality and cognitive style, so in terms of definitions of mental illness, so it's very varied, no? The acceptability of mental distress as opposed to physical distress. You see, or we are going to look into the usage of medical and psychological services. This is the one. if you're going to observe so many psychiatric clinics in the United Arab Emirates, there are only few. I believe in Ras Al Khaimah, we have already removed our psychiatric hospital here, and we moved to Al Amal Hospital, although we actually retain the OPD. But chances are in the OPD, only few people are actually coming to see the psychiatrist and the psychologist at residence, no? And of course, there is a difference and variations of the views on the origins and treatment of illness, as I mentioned to you. In some other countries, they view mental illness as purely spiritual. So the cause of mental illness could be the evil incarnate, the devil's spirit, no? Among others. So the only thing that we can actually do in order to remove them is when we pray for them. All right? In psychology, we have to acknowledge that definitely religious belief play a very important role in the treatment of mental disorder. So we utilize that, no? We utilized some sort of spirituality in the treatment of mental disorder. This is a part of eclectic therapy, as I discussed to you earlier. All right? Now, here is the data that we have in the United States and Canada. You can actually see the rising rate of psychiatric hospitalization. The acceptance of mental disorder is already, widely attributed to the open-mindedness of people, no? Especially there is the advent of depression in these countries before. So definitely they would tend to seek the help of psychiatrists and psychologists. Openly, they can just actually go and walk. But here, in other countries also, you cannot just do that. You know why? Because if you're going to tell, I would like to see my psychiatrist, some people will actually brand us as we are crazy. See? Technically, every single individual is adjusting every day. Some sort of, at one point in time, we need the help of psychologists. You see? Especially when the pressure is too much, when the stress is too much, we need really the help of people who are very professional to listen to us. In that case, we can actually more effective if we are going to be very, let's say, if we're going to seek treatment when the condition or when our condition is still on the mild stage. Something like it will be difficult already when we actually have increased the gravity of our illness, no? When our conditions become worse. That will be a very big problem. That's why also there is a reported and rising report of mental illness in these countries, just because the reporting is attributed to the openness of people to go to the psychiatrists and psychologists. So they will report on this, right? Okay. Now, on the other hand, you see, the thing that I'm actually telling you, in other country, homosexuality is banned. In United States and in other countries, homosexuality is acceptable. It depends. Now, when you say, we view at one point that homosexuality is a mental illness. This was defined previously in Diagnostic Statistical Manual 5. But this is basically removed right now because they don't attribute homosexuality as a problem, as a mental health problem. In fact, our organization, the American Psychological Association, recently established transgender psychology, where these psychologists devote their time in studying homosexuality among others. No? But as of this time, DSM does not view homosexuality as a mental disorder. But in most of the Muslim countries, these are even outlawed. No, you are not allowed to do that. This is haram, definitely. So that I accept also because God created only man and a woman. But of course, the point of view of psychologists in other countries are a little bit liberated. So they recognize homosexuality before as a mental disorder, but right now, homosexuality is not. No. Okay. Now in China, there is a current practice to institutionalize members of the Falun Gong before the religion, no? Because there are people who are actually go extremely to specific religion, to specific practices, to the extent of sacrificing themselves. I think if you have Netflix, no, there is a follower or there is a there is a group that is attributed to extreme religiosity. I was watching that now. So Shella, the group of Shella and others, and many years ago, there is a part of Texas where religious leaders killed, murdered their members. In other countries, like in China, Falun Gong members would always be associated with some of the killings, or no, something like that. No, in Korea before also, cult followers would always follow the orders of their leaders to hurt other people. These are extreme. So in that case, there could be a problem. Is that attributable to mental disorder? Definitely yes. Okay, it could be a mental disorder as such. This is the thing that I'm actually telling you, no? Mental disorders could always be treated by medicines such as Prozac, no? Serapin, that is another name for Prozac. But of course, Prozac was also banned. In the United Arab Emirates, you cannot take any medicine without the prescription of a psychiatrist, or else you'll go to jail, because these are all regulated, highly regulated, and these are all having an effect to the chemistry of our brain as such. Okay? Now, among others, these are types of mental disorders that we know of. The group of mental disorders that we know of, no? Personality disorder. This is one of the most common, but of course, if you have personality disorder, nevertheless, you do have what we call as histrionic, and at the same time, borderline personality disorder, you do not need hospitalization, right? People with personality disorders would tend to live with the society. They may actually pretend to live in the society, pretend to live harmoniously in the society. See? Among the classic case of people with personality disorder are those people who are pathological liars, pathological thieves, pathological killers. We call that sociopath, and medically and psychologically we call them to have what we call as antisocial personality disorder, because they always love to violate the norms set by the society. Okay. Then, of course, we have anxiety disorders. Anxiety disorders are very common. In fact, most of us may actually have this, no? But the gravity will be different. So, anxiety disorders are disorders attributed to our fear of the future, in that case. In the context of Sigmund Freud, you see there is a problem between your id and your superego in that case. So the classification of anxiety disorders would be mild, moderate to severe. So that's the thing, no? And again, the level of functionality will determine if you need hospitalization or not. When the functionality is really affected, you need hospitalization, no? But of course, the fourth degree of anxiety disorder would always be the panic disorder. If you are afraid of something else, it's still under anxiety disorder, like in the case of specific phobia. All right? Then we have the mood disorder, or we call it as affective disorder. It has something to do with our emotion, like in the case of manic disorder, like in the case of depressive disorder, or a combination of these disorders, depressive, manic disorder. We call that as cyclothymic disorder, dysthymic disorders, among others. Okay? And then, of course, we have other disorders, like in the case of cognitive disorders as such. So moving forward, now, what do we have with these disorders? person with personality disorders would always be very inflexible. They have inflexible patterns of inner experience and outward behavior, which deviates markedly from one's culture. We tend to move away from what is acceptable in the society. Now, the following manifestations would always be some sort of paranoid, no? Under paranoid personality disorder, or it could be under cognitive disorder in that case. There could be schizoid. There could be antisocial. That's the most common, the criminals, no? Borderline, we need hospitalization. For antisocial, they need jail. For borderline, they need hospitalization because they tend to hurt themselves. Narcissistic, these people who really love themselves so much. No, they are very deluded also that they are very famous in any way like that. No, then histrionic, they really would like to be dramatic in any way. Avoidant and dependent. These are all very common classification of deviancy among personality disorders. It has something to do with our inner experiences. I'm going to give you like for instance, dependent personality disorder. So mostly people are sufficient to live alone or individually, but people with dependent personality disorder cannot live on their own, cannot live individually, especially when they are married and the marriage is already on the brink of divorce, the marriage is already very violent. What's happening is that one among the spouses will actually divorce one, and that person who is being divorced will always say, I cannot live without you. Because that person is very dependent in the husband or in the other spouse. That is the meaning of dependent personality disorder. One who cannot live without the other. If a person is removed from that particular object of interest, then he would rather die. That is actually the meaning of dependent personality disorder. Now, I'll show you, that's the reason why I mentioned to you earlier that the most common of personality disorders that we have are those with antisocial personality. It shows a pervasive pattern of disregard for and violation of other people's rights. They kill, they rape, they violate all sorts of rules in the society. Now, up to 3.5% manifest of these disorders, of personality disorders, manifest an antisocial personality disorders according to EPA. It even increased now, no? Now, what are the symptoms? There is a repeated, deceitful, irresponsible with everything. Irresponsible with their money, then they steal, they spend their money, then steal again, among others. They are very impulsive. They have the tendency to start fights. They are very egocentric. They do not have regard for safety. Those people who are really trying to impress other people, all right? They do not have regard of safety. They do not have the regard of, the roles set by the society, among others. We can actually see them. They are living among us. All right? So we need to spot them and we need to help them in any way. Like in the case of pathological liars and pathological killers, we call them as serial killers. They really hate other people. They do not have regard on the life of other people. So killing another person is just a routine. They do not actually experience guilt at all. So guilt is absent in this case. They can do anything they want, disregarding what the society set as a rule. So this is usually the problem that we may actually have with people who do have antisocial personality disorder. Anyway, I'm going to stop here and I'm going to continue this on Monday. So are there any questions that you would like to ask? People, any question?
Thank you, Doctor. No.
All right, so again, I will repeat, your CA is is on May 6th. The coverage will be pain, personality, and counseling. For the quiz, those whom I approve, the coverage is only on personality. Okay? Good luck with that. All right? Is there any question that you would like to ask?
Thank you.
Okay. If there are no questions, then please write your ID numbers and you're good to go.
Thank you, doctor.
Thank you. Bye-bye.